Hello and welcome to another edition of the Ask Dr. Pickel show, where we help people find answers to chronic conditions, chronic health problems. All right, so today's show kind of interesting. I want to get into some information here. I had a patient recently, not too recently, that it was a husband and wife, and the wife actually came in for some problems. But she also asked some questions about her husband, and her husband said, yeah, he had been feeling a lot more emotional lately, just tearing up for no reason. He noticed weight gain. He noticed he was feeling weaker, having some problems with libido, just, quite a few things. And he said, it's just kind of slowly been coming on, and, but they didn't know if it was a problem or not. And so, we kind of talked about some things. I want to get into what we talked about and what really was occurring with this gentleman. So let's dive right in with this, with our topic here, which is more about blood sugar issues and how this can cause problems in men on the hormonal side. Because when we talk about hormones, it's usually women you talk about hormones with, estrogen, progesterone balances and things like that. But when it comes to men, there can also be issues there too. And in fact, there's a time in life where men even go into almost like a menopausal type state too. In fact, they kind of kicked it out, but originally it was introduced as menopause, which that's not really what we're going to talk about today. We're going to talk about how blood sugar affects this, which can occur really at any age, pretty much. So let's dive right in here to some interesting information. So first of all, there's this word on here, aromatization, and what the heck does that mean? So I'm going to talk about that too, because that kind of brings in some questions there. So basically, some of the symptoms of that. Let's start off with that. What are some of the symptoms if you have blood sugar problems, whether it be diabetes, metabolic syndrome? There are many diagnoses: metabolic syndrome, prediabetes, insulin resistance, hypoglycemia. If you have any blood sugar symptoms, you have a high potential for hormonal problems. A lot of hormonal, whether they be male or female, hormonal problems, a lot of them are due to blood sugar issues. But we're going to talk about a certain type here that especially can occur in men. So some of the symptoms of this can be more emotional than usual. Actually, another one, a very common one that you may see in men, is they'll develop breast tissue. Yeah. The chest will start to grow. And actually there's a term for this. It's called gynecomastia. But this can occur in kids. It can occur in adults, teens. Not a good thing. And we start to get growth of the breast tissue. And then another one can be a loss of drive or motivation. What is that? That means, maybe in the past you've been like, gosh, I get things done. I'm pretty motivated. But now I'm like, gosh, I could just sit in this chair all day and do nothing and be perfectly happy. Just that lack of motivation, that lack of drive and get up and go. Another one can be weight gain. And with this type of issue, the weight gain won't be in the typical spot. Now, usually with testosterone, men will gain more weight in their belly, like a belly that you see that's out in front of you. If we see the type of issue that I'm going to talk about, blood sugar problems and aromatization, weight gain will occur more in the flank area, the hips, typically in areas that you'll see it more in women. So kind of interesting there too. And so we'll actually even get signs of feminization. And sometimes this can get bad enough to the point where you'll notice facial features can change some, hair growth can change some. There's a lot of different factors, but they call it feminization, and you can kind of look that up too. Also, there can be some other problems here too. We can get prostate enlargement, which is not good, and that can start to cause some, you can't urinate very well. Also, we can get decreased, that's a down arrow, decreased muscle mass. And another one common, like this gentleman complained about, low libido. All right. And actually there can be others here, but these are some of the main ones that can occur in men and start to make them think, or their spouse think, hey, what's going on with you? What's happening here? All right. So when we see this, what's really going on, and what is this aromatization about? So let's kind of switch here, and let's first let's talk about. So there's what's called insulin resistance. And if you need more information about blood sugar issues, check out some of our other videos that are out there, because there's some great information on them. But the thing is let's put it this way. If your blood sugar is too high regularly, blood sugar doesn't just float around in your bloodstream by itself. It actually has to have what's called insulin. Insulin is made in your pancreas. Insulin is like a taxi cab that carries blood sugar to your cells, knocks on the door, says, hey, here's your blood sugar. And then the receptors on the cell, little doorways on the cell, open up, take the blood sugar, and then we can manufacture energy and other substances. So the thing is, though, is if you make too much insulin, if you get an insulin surge, which if my blood sugar goes up quickly, if I eat a piece of candy, or if I had low blood sugar and I suddenly ate something, and it'll cause my blood sugar to go up quickly because my body says, emergency, get this in here quick. We'll get these insulin surges, these insulin tidal waves. And if you do that enough on a regular basis, if you have elevated insulin, or maybe you take or inject insulin, the thing is insulin is regulated in our body. Our body knows exactly how much insulin it needs and how much it doesn't need, unless it has a problem. If we're making too much insulin, insulin is pro-inflammatory, meaning it causes inflammation. It's like pouring gas on a fire. So too much insulin equals inflammation, and now that inflammation affects our cells of our body, and our cells go, whoa, I'm not opening the door to the blood sugar delivery guy. The insulin comes in and says, hey, I got your blood sugar here. The doors aren't opening because there's a fire in the house. So now we have what's called insulin resistance. So all that blood sugar doesn't get into your cells. Then the body says, you know what? We can't taxi this blood sugar around in your bloodstream forever. Store it for later. So now when we have this insulin resistance, or hypoglycemia, which is low blood sugar, and even if we'll put even functional hypoglycemia. And what does that mean? That means if it's less than 85. If your blood sugar drops to less than 85, that's functional hypoglycemia. Now, a lot of times your doctors may not diagnose you till you get below like a 70 or a 65. By that time, you're passing out. You're having all kinds of other issues there. If you get below an 85, still too low. So either one of these, if they occur, they will cause insulin surges or insulin tidal waves. Let's put it that way. All right. So if we get insulin surges in the human body, a male human body, that insulin goes over here, and it activates an enzyme in the body. Now, men and women both have this enzyme that can be activated, but in men, it does one thing. In women, it does another thing. We're talking about men today. So that enzyme is called aromatase. We won't talk about the meaning of that word as much, and it's not like, hey, we smell fantastic. No, aromatase. So this enzyme, what does it do? What's the problem if you activate this aromatase enzyme? Well, yikes. This starts to convert testosterone to estrogen. Okay, there you have it. Oops. Getting different things there. Sorry, guys. Estrogen. So one will turn into the other if this is going on. So we don't want that happening in men. So if that testosterone converts to estrogen, then we start to get these symptoms. And this can be a slow process. This can come on over time. And the problem is, though, is if that keeps occurring, it's going to create other problems. It's going to create those symptoms we mentioned. And one of them that I didn't put on there too, well, I did put drive and motivation, but the frontal lobes of a man, the executive area of the brain, that's where you need testosterone to give you drive and motivation. And actually, it can affect all kinds of factors there. And again, if you're getting estrogen there, yeah, it'll make you feel like, gosh, just really no drive or motivation. But again, a lot of these other symptoms can start to occur, like the gynecomastia and the weight gain and the decreased muscle mass. So again, this is very important. Now, the problem is, though, is this can start a cycle. This can start creating because if we're getting this, now we have an abnormal estrogen to testosterone ratio, or we could put it the other way, testosterone to estrogen ratio. And what does that do? That actually creates more insulin resistance. So now you have kind of this perpetual cycle here going on that just keeps going round and round as symptoms increase and increase. So you got to halt that. What's the way you halt that? How do you halt that? What's the way? How do you halt that? Well, you got to get these under control. That's the key. You get those under control, then this can be stopped. Because the problem is and I've seen this where other patients have done this, male patients have done this before coming into care with us, is they actually went into another doctor, and this doctor said, okay, you're getting these symptoms of low testosterone. So we're going to add testosterone. We're going to start injecting testosterone, or we're going to give you a testosterone pump, or adding testosterone to the symptom on top of a blood sugar issue. So what's going to happen to all that testosterone they add into that man? Well, at first it might raise the testosterone level, and it's like, hey, I'm feeling a little better. But as the blood sugar problem continues, it's going to start to convert that testosterone that's brought in into more estrogen, and now we'll get this flood of estrogen, and then the person is 10 times worse. And that's what happened to a patient I had a few months ago who just got that testosterone, feeling great for about 30 days, and then he said just everything fell apart. His wife was saying, yeah, just the symptoms got like 10 times worse, and they didn't know what to do. So again, the thing, of course, the key with this is the blood sugar issue. Now, how do you fix blood sugar issues? We have that in other videos, but the thing is sometimes it's your diet, very common. many times it's because your gut's inflamed. And if your gut's inflamed, you mainly absorb sugars and carbs, but not the important bigger molecules like proteins, fatty acids, minerals. So again, it's finding out what's inflaming the gut too and getting that under control so you start to absorb things properly. But it's getting the person out of this insulin resistance, getting the person out of this low blood sugar scenario. And then this whole thing starts to wind down and change and stop the cycle. So, all right. Well, I hope everybody got a lot of good information out of this today and enjoyed the show. And definitely, if you get a chance, don't hesitate to share us on Facebook, YouTube, or Twitter. So, okay. You guys have a wonderful day and God bless. And I'll see you next time.